Hi, my name is Fatima Romo and I'm going to talk about Erythema Gyratum repens associated with anal cancer. Definition: Erythema gyratum repens most often represents a paraneoplastic figurate erythema. The most common underlying plants are lung, breast, or esophagus, and anal. Anal cancer is a cancer which arises from the anus, the distal opening of the gastrointestinal tract. The rash can appear either before or after detection of the malignancy. The rash is striking, characterized by dried red plaques that can advance their age by up 1 centimeter per day. The skin lesions resolve when the malignancy is treated.
Greetings. I'm Dr. S. Monish Balaji, known as SMB. Today, we'll be talking about erythema in medicine, part 1. So, what is erythema? It is defined as abnormal redness of the skin or mucous membranes due to capillary congestion. This image shows erythema gyratum repens. Erythema gyratum repens is a figure-8 erythema believed to be of paraneoplastic etiology. It involves the trunk and extremities and presents with pruritus. It presents as concentric, mildly scaling bands of flat to raised erythema, giving typical wood grain appearance. The course of erythema mirrors that of the underlying disease. This shows the resemblance between wood grain seen in the image on the left side and Erythema gyratum repens in the image shown on the right side. The causes of Erythema gyratum repens are 1. Malignancies. The most common malignancy reported to cause this is lung cancer. The others are breast cancer, bladder cancer, uterus, cervix, GI, and prostatic malignancies. Crest syndrome, pulmonary tuberculosis, cryptogenic organizing pneumonia, pityriasis rubra pilaris, psoriasis, vaginal breast hypertrophy, and in many cases the cause remains unknown. This image
Applications in medicine. A 73-year-old woman presented with an involving pruritic erythematosus rash and was found to have an anal cancer. It may be diagnostic clinically. Also, a skin biopsy is often performed to exclude other conditions. The histological features of erythema gyratum repensens are non-specific. The treatment for this is to identify and treat the primary malignancy. It usually revolves once the malignancy has been removed, for example, with surgical resection.
Our next speaker is Dr. Ridge, who is going to present non-paraneoplastic erythema gyratum repens.
Good morning. This is the case of a 65-year-old female who presented to us last July with a 5-month history of a widespread itchy rash. Her GP had been treating her in the community as eczema. This lady was a previously healthy, non-smoker, non-drinker, taking no regular medications. It's important to note that this lady had a significant family history of cancer. So her daughter died of ovarian cancer at age 16, and 2 of her sisters had breast cancer in their early 50s. So on examination, as you can see, there's erythematous gyrate concentric bands arranged in parallel with a fine trailing scale. It's involving her upper limbs, lower limbs, and trunk. So our working diagnosis at the time was erythema gyratum repens, and our differential diagnosis included tinea imbricata, erythema annularis centrifugum, and an EGR-like eruption. So this is where a different dermatoses mimics EGR in its clinical presentation, for example, of vasculitis. So we began with the paraneoplastic workup, and all of our routine bloods were negative, and we did a CT neck and TAP, which was negative for malignancy. So we did 3 punch biopsies and a DIF. This first image here is a low power view, and then this image demonstrates the thickened and irregular epidermis with acanthosis and parakeratosis. And this then demonstrates the lymphohistiocytic perivascular infiltrate. So these histological features are all non-specific, but in correlation with the clinical findings, they are supportive of a diagnosis of erythema gyratum repens. And although the histology is non-specific, it is useful because it helps to outrule mimickers of EGR. So initially we treated her with topical steroids and topical antifungals, but when we brought her back to clinic 2 weeks later, there was no improvement. So we then expedited a further paraneoplastic workup, including a full body PET CT, which was negative. We did tumor markers, paraneoplastic antibodies, upper and lower GI endoscopy. So the endoscopy was negative for malignancy, but what's interesting is it did demonstrate a severe pangastritis, which was CLO positive, and this indicates an active Helicobacter pylori infection. So she was then placed immediately on triple therapy eradication for H. pylori, and this consists of amoxicillin, clarithromycin, and a PPI for 14 days. So as you can see here, towards the end of the course of triple therapy, her skin did improve, and she's clear of erythema gyratum repens following the 14-day course.
Pros and cons. Pros. Corticosteroid injections may improve the pruritus but reportedly do not change the appearance of the skin eruption. Improvement of erythema gyratum repens often occur with successful treatment of the underlying cancer. Also, the treatment is directed towards the background neoplants that, if controlled, resolve the rash. Cons. The most important associated symptoms as itching and histology is non-specific. This rash has the characteristic of modifying its drawing, moving of the surface of the skin at a rate of 1 centimeter per day. They have proven that it is more common in children than in adults, the prognostic significance of these lesions being not clear. Issue applied in Ecuador. Although there is no information about this disease in Ecuador, it is said that investigations to be undertaken may include a complete blood count, biochemistry, anticoagulate antibody profile, and malignancy screens. like is chest X-ray, mammogram, cervical smear, tumor markers, computer tomography of the chest, abdomen, pelvis, and if indicate endoscopy and colonoscopy. Also, in conclusion, the relationship between anal cancer and erythema gyratum repens is direct, since this pathology, being considered as a paraneoplastic lesion, the associated with anal cancer is common. Erythema gyratum repens consists of concentric erythematous lesions in the back, and if the patient already has cancer cells, the lesions reach the anal region. The skin shows patterns of erythema in the front of the wooden veins. Thank you.